This presentation will cover a few of the most common problems that may cause you to consider providing first aid. There are many other situations that call for first aid. It's a good idea to have a first aid guide and a well-stocked kit in your home and car. Before you can provide help to someone else, you need to make sure that the scene of the incident is safe. Don't panic. Do not attempt to assist victims if you are in danger. Call 911 or your local emergency services quickly. Be sure to give your name, location, and a brief description of the incident and how many people are involved. Bleeding. Before initiating any first aid to control bleeding, be sure to wear healthcare gloves to avoid contact of the victim's blood with your skin. Act quickly. With severe bleeding, have the victim lie down. Call 911 or your local EMS. Control bleeding by applying steady, direct pressure on the wound. You can do this with a sterile pad, bandage, or clean cloth for a full 5 minutes. Control bleeding before trying to clean the wound. Hold the part of the body that is bleeding higher than the heart. If blood soaks through the pad or cloth, apply another one without lifting the first. If bleeding is not controlled by use of direct pressure, apply a tourniquet only as a last resort and only if you've been trained in how to do so. When emergency help arrives, explain how long the tourniquet has been in place. Nosebleeds. Sit upright and lean forward. By remaining upright, you reduce blood pressure in the veins of your nose. This discourages further bleeding. Sitting forward will help you avoid swallowing blood, which can irritate your stomach. Pinch your nose. Use your thumb and index finger to pinch your nostrils shut. Breathe through your mouth. Continue to pinch for 10 to 15 minutes. Pinching sends pressure to the bleeding point on the nasal septum and often stops the flow of blood. To prevent rebleeding, do not rub or blow your nose and don't bend down for several hours after the bleeding episode. During this time, remember to keep your head higher than the level of your heart. When should you seek emergency care for a nosebleed? If you're bleeding severely and profusely, you feel faint or lightheaded, you start bleeding after an injury or trauma. When caring for minor cuts and scrapes, follow these guidelines. Wash your hands. This helps avoid infection. Stop the bleeding. Minor cuts and scrapes usually stop bleeding on their own. If needed, apply gentle pressure with a clean bandage or cloth and elevate the wound until bleeding stops. Clean the wound. Rinse the wound with water. Keeping the wound under running tap water will reduce the risk of infection. Wash around the wound with soap. Avoid getting soap inside the wound. Don't use hydrogen peroxide or iodine, which can be irritating. Cover the wound. Apply a bandage or gauze. Covering the wound keeps it clean. If the injury is just a minor scrape or scratch, leave it uncovered. Change the dressing. Do this at least once a day or whenever the bandage becomes wet or dirty. Watch for signs of infection. See a doctor if you see signs of infection on the skin or near the wound, such as redness, increasing pain, drainage, warmth, or swelling. Burns and scalds. A burn is tissue damage that results from scalding, overexposure to the sun or other radiation, contact with flames, chemicals or electricity, or smoke inhalation. A minor burn that doesn't require emergency care may involve superficial redness similar to a sunburn, pain, blisters, an area no larger than 3 inches in diameter. When treating minor burns, cool the burn. Hold the burned area under cool running water or apply a cool, wet compress until the pain eases. Remove rings or other tight items from the burned area. Try to do this quickly and gently before the area swells. Don't break blisters. Fluid-filled blisters protect against infection. If a blister breaks, clean the area with water. Bandage the burn. Cover the burn with a sterile gauze bandage. Wrap it loosely to avoid putting pressure on burned skin. Bandaging keeps air off of the area and reduces pain and protects blistering skin. Call 911 or seek immediate care for major burns, which are deep, cause the skin to be dry and leathery, may appear charred or have patches of white, brown, or black, are larger than 3 inches in diameter. Treating major burns. Protect the burned person from further harm. If you can do so safely, make sure the person you're helping is not in contact with the source of the burn. For electrical burns, make sure the power source is off before you approach the burned person. Remove jewelry, belts, and other restrictive items, especially around burned areas and the neck. Burned areas swell rapidly. Cover the area of the burn. Use a cool, moist bandage or a clean cloth. Don't immerse large, severe burns in water. Doing so could cause a serious loss of body heat. Elevate the burned area. If possible, raise the wound above heart level. Watch for signs of shock. Signs and symptoms include fainting, pale complexion, or breathing in a notably shallow fashion. Chemical burns can be caused by many substances, such as strong acids, drain cleaners, paint thinner, and gasoline. When treating chemical burns, remove the cause of the burn. Flush the chemical off the skin with cool running water for at least 10 minutes. For dry chemicals, brush off any remaining material before flushing. Wear gloves or use a towel or a brush. Remove clothing or jewelry that has been contaminated by the chemical. Bandage the burn. Cover the burn with a sterile gauze bandage or clean cloth. Wrap it loosely to avoid putting pressure on burned skin. Flush again if needed. If you experience increased burning after the initial flushing, flush the burned area with water again for several more minutes. Heat exhaustion is one of the heat-related syndromes. Symptoms range in severity from mild heat cramps to heat exhaustion to potentially life-threatening heat stroke. Heat exhaustion can begin suddenly or over time, usually after working or playing in the heat, perspiring heavily, or being dehydrated. Heat exhaustion signs and symptoms include cool, moist skin, heavy sweating, faintness, dizziness, fatigue, weak rapid pulse, muscle cramps, headache, and nausea. Untreated heat exhaustion can lead to heat stroke, which is a life-threatening condition. If you suspect heat exhaustion, take these steps immediately. Move the person out of the heat and into a shady or air-conditioned place. Lay the person down and elevate the legs and feet slightly. Remove tight or heavy clothing. Have the person drink cool water. You can cool the person by spraying or sponging them with cool water and fanning. Call 911 or your local emergency number if the person's condition deteriorates, especially if he or she experiences fainting, confusion, seizures, and an inability to drink. Heat stroke occurs when your body temperature rises rapidly and you're unable to cool down. It can be life-threatening by causing damage to your brain and other vital organs. It may be caused by strenuous activity in the heat or being in a hot place for too long. Heat stroke can occur without any previous heat-related condition, such as heat exhaustion. Signs and symptoms include a fever over 104 degrees Fahrenheit or greater, changes in mental status or behavior such as confusion, agitation, or slurred speech, hot, dry skin or heavy sweating, nausea and vomiting, flushed skin, rapid pulse, rapid breathing, a headache, fainting, which may be the first sign in older adults. If you suspect heat stroke, call 911 or your local emergency number, then immediately move the person out of the heat. Remove excess clothing and cool him or her by whatever means available. For example, you could place them in a tub of cool water or a cool shower. If the incident occurs outdoors, you could spray them and cool them down with a garden hose. Fan them while misting them with cool water. Place ice packs or cool wet towels on the neck, armpits, and groin area. Cover them with a cool, damp sheet. Shock is a critical condition brought on by the sudden drop in blood flow through the body. Shock may result from trauma, heat stroke, blood loss, an allergic reaction, severe infection, poisoning, severe burns, or other causes. When a person is in shock, his or her organs aren't getting enough blood or oxygen. If untreated, this can lead to permanent organ damage or even death. Signs and symptoms of shock vary depending on circumstances and may include cool, pale, clammy skin, rapid pulse, rapid breathing, nausea or vomiting, weakness or fainting, dizziness, or unconsciousness. If you suspect a person is in shock, call 911 or your local emergency number, then immediately take the following steps. Lay the person down and elevate the legs and feet slightly unless you think this may cause pain or further injury. Keep the person still and don't move him or her unless necessary. Cover the person with a blanket to prevent chilling. Don't let the person eat or drink anything. Most reactions to insect bites and stings are mild, causing little more than redness, itching, stinging, or minor swelling. For mild reactions, if needed, remove the stinger. Wash the area with soap and water. Apply a cool compress. use a cloth dampened with cold water or filled with ice. This helps reduce pain and swelling. If the injury is on an arm or a leg, you can elevate it. When do you need to seek emergency care? When you have difficulty breathing. If there's swelling of the lips, eyelids, and throat. Dizziness, faintness, or confusion. Rapid heartbeat. Hives. Nausea, cramps, or vomiting. Choking occurs when a foreign object lodges in the throat or windpipe, blocking the flow of air. The universal sign for choking is hands clutched to the throat. If the person doesn't give the signal, look for these indications. Inability to talk, difficulty breathing or noisy breathing, squeaky sounds when trying to breathe, cough, which may either be weak or forceful, skin, lips, and nails turning blue, skin that is flushed then turns pale or bluish in color, a loss of consciousness. If the person is able to cough forcefully, the person should keep coughing. To perform abdominal thrust on someone, stand behind the person. Place one foot slightly in front of the other for balance. Wrap your arms around the waist. Tip the person forward slightly. Make a fist with one hand. Position it slightly above the person's navel. Grasp the fist with the other hand. Press hard into the abdomen with a quick upward thrust, as if trying to lift the person up. Perform between 6 and 10 abdominal thrusts until the blockage is dislodged. To clear the airway of a choking infant younger than age 1, assume a seated position and hold the infant face down on your forearm, which is resting on your thigh. Support the infant's head and neck with your hand and place the head lower than the trunk. Thump the infant gently but firmly 5 times on the middle of the back, using the heel of your hand. The combination of gravity and the back blows should release the blocking object. Keep your fingers pointed to avoid hitting the infant in the back of the head. Turn the infant face up on your forearm, resting your thigh with the head lower than the trunk. If the infant still isn't breathing, using 2 fingers placed at the center of the infant's breastbone, give 5 quick chest compressions. Press down about 1.5 inches and let the chest rise again in between each compression. Repeat the back blows and the chest thrust if breathing doesn't resume. Call for emergency help. If you've been trained, start infant CPR. If the child is older than age 1 and conscious, give abdominal thrust only. Be careful not to use too much force to avoid damaging ribs or internal organs. To prepare yourself for these situations, learn CPR and a certified first aid training course. Thank you for viewing the presentation today. Stay safe.